Okay, Gautam ji, kindly start.
Okay, sir. Namaste, everyone. It is my privilege to hello. Ji. Hello.
Yes, please continue. Be louder, please continue.
Namaste, everyone. I am Gautam. In ancient India, young seekers would approach learned sages with one burning desire to acquire knowledge and excel in their chosen path. The sages, in turn, would not only teach them but also prepare them to apply their learning effectively in real life challenges. Inspired by this timeless tradition, Yashasvi Bhav, prepare, perform, prosper, has been designed as a beacon of guidance for second BMS students. This program is our modern day Gurukul, a comprehensive exam oriented series tailored to help second BMS students master every subject with the support of expert professors. With features like dedicated doubt solving sessions, model question paper practice, and daily classes aligned with the CBDC curriculum, Yashasvi Bhav ensures you are not just prepared but empowered to excel. I take the opportunity to introduce our guest lecturer for this session, Dr.Sheethal.V, Associate Professor and HOD in the Department of Roga Nidana evum Vikriti Vignana in SVM Ayurvedic Medical College, Ilkal. Ma'am has completed her UG in hello, hello, hello.
Yeah, this is audible.
Ma'am has completed her UG in Taranath Government Ayurvedic Medical College, Bellary, and PG in Government Ayurvedic Medical College, Bengaluru. Ma'am has total teaching experience in 7 years in different colleges of Karnataka, and she is currently working as Associate Professor and HOD in SPM Ayurvedic Medical College, India. She is a natural remedy expert and Ayurvedic healer. Ma'am has presented many paper presentations. One of among that, a study on the etiopathogenesis of Amavata with respect to rheumatoid arthritis and its samprapti. And she has attended more than international conferences in different areas. She has presented many poster presentations and article publications, attended various national and state level seminars, workshops, and CMAs. And also, ma'am has attended one TV program with regarded to Ayurveda. We welcome you, ma'am, for this session, and I request ma'am to start this session. Thank you. Welcome you, everyone, for this session.
Thank you. Thank you for the introduction. A very good evening to all of the participants who are attending this session. I am Dr. Sheethal, Associate Professor in the Department of Roga Nidana evum Vikriti Vignanam, working as an Associate Professor in SVM Ayurvedic Medical College, Ilkal. Today, the topic allotted for me is Roga Nidana. So that is Vyagni Vignana Paper-2. So let's begin. So here, just like paper 1, so you will be having this paper for 100 marks. So this 100 marks, it is distributed into 3 parts. Okay, so that is, so long essay questions, short answer questions, multiple choice questions. You will be having totally 4 number of long answer questions. So each will be carrying 10 marks. Okay, so this next short answer questions, you will be having 8 questions and each will be carrying 5 marks. So totally 40 marks. So remaining pattern, that is MCQ questions, you will be having 20. Okay, so here each will be carrying 1 mark. So totally 20 marks. Okay, so here, I'll move to next slide. So next, in the next slide, so how this long answer question, short answer questions or MCQs, they are divided. In the NCSM, so the CBDC, so they have divided according to must know part desire to know part and nice to know part. Okay, so here you will be having 4 long answer questions. So from the must know part only, and there will be no desirable to know part and the nice to know part. Okay, in the short answer questions, so you will be having 7 questions from the must know part and 1 short answer question from the desirable to know part, and no any nice to know part. Okay, so from the what short answer questions, and in the multiple choice questions you will be having 15 MCQs questions from the must know part and 3 MCQ questions from the desired to know part and 2 MCQ questions from the nice to know part. Okay, so before this one going to next slide, so we'll go once through the what blueprint. Okay, so which has been clearly mentioned in the what syllabus. Okay, I will just share. Actually, that document it is not going, it is not opening.
What happened, ma'am? You're not able to share the screen, ma'am?
Yeah. There is some more disturbance.
No, ma'am. Once you can try, ma'am. Again, you can try. You're sharing in laptop, right, ma'am?
No. I'm sharing it in mobile.
Okay, ma'am. You can share it again, ma'am. You can reshare it, ma'am. It will open now. Share screen option you can give and you can do it, ma'am.
I am sharing through that one only, but it is not getting opened.
Ma'am, you can send the PDF to me, ma'am, so that I can.
Okay.
Please share the PPT or PDF immediately to me, ma'am. I will share it to our team.
I have sent the PDF.
Yes, ma'am. Yes, ma'am. Just a minute, ma'am. Our technical team will share it on the screen, ma'am.
Okay.
So you can go on explaining. They will move the slides, ma'am. You need not worry about the slide moving.
Okay. this page number 86. Just please go through page number 86. Yeah, from this part only. From this part only. Okay, so if you look it in the paper 2, so from the Agni Mandya part, just scroll down. From the Agni Mandya part 2, next part. Next. Wait, just don't. From the, just you go. Up. Yes, that's okay. From the Agni Mandya part to Pandu part, so you'll be having 43 marks. So from these topics, you will be having, so the mass distribution, it is according to the what? Topics, okay, they have divided. And from the Rakta Pitta part to next, just move, next. Rakta Pitta part 2, wait. Rakta Pitta part 2, thyroid disorders. So the marks allocation is 25 marks. Okay. So from Sthaulya part 2, next. From the Sthaulya part 2 till tuberculosis. So the marks allotment is 32 marks. Okay. So next we'll move to the, so here next one more is there. One more is there. Just please share that PDF. I have sent you one more PDF file. Yeah. So recently, a few corrections came from the NCSM. So, but they were not that much major, only minor corrections from the MCQs. So this one, just move the next page. Wait. So here, so here, next. Wait. So this part you can see from the Agni Mandya part till Vatarakta. So these all topics, they are compulsory for 10 marks. So means, so these are allotted. So this, you should not leave any point from this topics. Okay. So next, so before that, so just go to next, not next. Go back, just go back. Yes. So these are short answer questions. Okay. So 5 marks. So each, so they will be carrying. And so here in this, all the modern points, they are included under desire to know questions only. So they will be one of the questions you will be getting for short answer questions. Okay. So that is from the desire to know part. And so the remaining part will be from the what? MCQ questions. So so I will share you the, you can I will share the PPT now.
Okay, ma'am.
Okay, so let's begin. So whenever, so paper 2 of Roga Nidana, it will come to your mind. So there will be so many questions arising in your mind. So that which disease will come in the exams. So whether Hetu, Purva Rupa, Rupa, Samprapti. So or if one disease, so the part asked in one disease. So in 1 year, if they will ask means the next year, they are not going to ask that one. So that's why, so this you can see on the screen. So the same disease, so they have asked in the what different patterns. Okay, let's see. So read it carefully. So and one more I want to tell you. So this one, before writing the answer, read the questions carefully. Okay, so what has been asked in the what 10 marks. Okay, so the pattern of asking, they will be different. For every questions, you can't write what Nidana, Pura, Rupa, Rupa, Upashaya, Samprapti. There will be the what specific terms. So what they will be going to ask. For example, if you look at the 3 questions, so the pattern is, so you read the first question, define Pandu, write the Nidana, Samprapti, Purva Rupa, Bheda and Lakshanas of Pandu. Okay, so the pattern of asking the next question is what? So that is write the Nidana, Samprapti, Bheda, Lakshanas and Sadhya Sadhyata of the Panduroga. See the first question. So they have not asked the Sadhya Sadhyata of the what? Panduroga. So but in the second question, they have asked what? So the Sadhya Sadhyata of the what? Panduroga. Okay. So when you come to the third question, so that is what? Explain Nidana Panchaka. In second paper, so whenever you will be explaining any disease, so just I want to tell you, don't write the Nidana definition, Purva Rupa definition directly. So you are learning about, so in the second paper, so it's mainly related to the what? Vyadhi Vigyana. So you are studying the individual disease. So you are not studying the Nidana Panchakas here. So directly you can go to the what? Specific Nidana of the what? Specific disease. Okay. So here they in the third question, that is related to what? Nidana Panchaka of the what? Panduroga. Okay. So this is, I am not giving the what? This important questions for the exam. Okay. So this, how the way of the questions they will be asked means just I am telling you people. So this one. So in the next question for the what? 5 marks. So I will share you. So for the 5 marks, so how, what the pattern of the, how they have asked, just read the questions. Okay. So here, so that is, so first that is what? Right, describe Pratyatma Lakshana of what? Pandu. Describe, next question, describe Hetu and Samprapti of the Pandu. Third question, explain the types of Pandu. Describe Purva Rupa of the Pandu. Fourth question. The fifth question, enlist Upadrava of the Pandu. Next question, describe Sadhya Sadhyata of the Pandu. Explain Pancha Pandu. So these I have not framed any questions. So just I have collected from your what? Syllabus copy. And you can see in the old question papers also, they have asked the different patterns. So that's why, so I will be sharing one disease. So this one I will tell you. So how to write the Nidana, how to, I will give the pattern of writing, because so if you are clubbing the all the points and if you are writing in the what paragraphs, that is no use in the what, in the second paper. Okay. So I will share you one by one. Okay. So while starting any disease, okay, so one by one I will share you. So here, so before writing any disease, so first you have to understand to which srotas it belongs. Okay, so to which, whether it is related to what prana. So if not only Panduranga, I am telling you. So this one first, whenever you will be reading the paper to know, just categorize into what? Srotas wise. Okay, disease wise. So whatever the disease you are having, no. So the first point. So if whether they may ask for what 5 marks, whether they may ask for what 10 marks. So you have to give introduction about the what? Disease. Okay. So here, so first you have to write down to which srotas it belongs. Okay. So next you have to write its what? Nirukti. Okay. So here, so I have used the term as what? Nirukti. So better use these type of the terms. Okay. So instead of definition, no. So use these type of the what? Terms. Nirukti. Okay. In that, if they have asked for what? 10 marks, then at least two shlokas you write down, or otherwise this one, at least one shloka you write down. Okay, so here that will be what beneficial. Okay, so that will be carrying more marks whenever you will be writing the what either if you have not memorized the shlokas, at least write these type of the what terms. For example, I have underlined the word also. So that is what Ketaki Dhuli Sannibam. Okay, so this one. So sometimes in the MCQs questions also they will be asking. Okay, so how that will be resembling to that of the what Polans. So and you have to write its meaning also. So don't, if you are writing only the shloka and if you are not writing the what this meaning, that is of no use. Okay, so here you have to write the what meaning also. Okay, so next you have to write down. So it's paryayas, if it is what applicable, not all the diseases you will be having the paryayas. Here, so in the Panduroga, so Shruta has mentioned some of the synonyms for the what? Panduroga. Okay, so this one, but it is not there in the syllabus. Okay, so but for some diseases they have specifically mentioned in the what syllabus copy. For example, Vatarakta. So how they have along with its synonyms. So there you need to write the synonyms of what? Vatarakta. So what do you mean by Kudda? What do you mean by Vatabalasa? So why it is called as Kudda? So this one, so it is going to affect the what rich person. At least you have to write its what meaning. So this one, it will be good when it specifically they will be asking at that time. Okay. So next slide. So Nidana. So whenever you will be approaching any Nidana part, so this one, so if you are memorizing the shloka, then it is well and good. So I suggest you people, so for the 10 marks question, so this one definitely you read at least shloka. Okay, so this one you have to present it. Okay, so next you have to divide the Nidana into the parts. So whatever they have mentioned in the what? So that shloka, for example, so you can see the shloka. So Sharamla Lavana Atyushna Viruddha Satmya Bhojanat, so Nishpava Masha Pilnya Katil. So that is there. If you are writing the same what in the what in the paragraph, that is of no use. Okay, so here divide it into what? So the parts. Okay, so here, so first that is what? Aharaja Nidanas. So this one, if you see the Aharaja Nidanas, so there you can see Shara, Amla, Lavana, Atyushna, Viruddha. So that you split it, that same, that shloka will be there, so this one you split that words. So this one, Ahara Sevana of the what? Atikshara, Amla, Lavana, Atyushna, Viruddha, Asatmya, Bhojana. So this one you divide it into what? Rasa, you divide it into what? Gunas, and you divide it into the what? Pattern of the what? Eating. Here I have marked the Mrut Bhakshana Janya Pandu. So this one, because so Mrut Bhakshana Nidana, so they have not mentioned it in the what? Charaka Samhita. So they Acharya Sushruta has mentioned it. So that's why I mentioned. So this one, when they will be asking specifically, at that time you add some terms that will be carrying the what? More weightage. Okay. So here, when it is coming to the what? This Viharaja Nidanas. So you can see. So that is what? So that part. So this one Divasopna during what? Anna Vidagdha Avastha, Ati Vyayama, Vyavaya. The whole shloka, it is divided into what? So 4 parts, but it is not applicable to all diseases. I will say so this one, because in some diseases Manasika Nidana's involvement will not be there. So that's why, so don't apply Aharaja, Viharaja, Manasika. So that type of the so Aharaja, Viharaja will be there, but sometimes Manasika involvement will not be there. And in some diseases specifically, just like what Kushta and the Udara Roga, there they will be having specifically Papa Karma. And in some bija dosha involvement will be there. That at that time you have to stress. Okay. And for example, in the what Vatarakrata, so there you will be having the 2 Nidanas. One is the Vata Prakopakara Nidanas and another one is the what? Rakta Prakopakara Nidanas. So at that time, so you should write both the Nidanas 3 related to that one. And there specifically they have mentioned with relation to the what? Prakruti Sambandita. So there you can add. So this one more, that is what? Prakrutita Sambandita. So this one, okay. So there, you can add like that, okay. And whenever you will be mentioning the samprapti part, no, so try to present the samprapti in the what flow chart. Okay, so here I am not explaining the disease, so this one how to write the disease, okay, for all the diseases, so I am explaining that one. Okay, so here, so whenever, so you are presenting the samprapti, no, so first you need to present, so this one, so don't write unnecessary samprapti. Okay, so this one, so the it should be in the word proper manner, whatever they have mentioned in the word shloka. Okay, it should be in the word, try to present the samprapti in the flow chart, and after completion of the flow chart, present the word samprapti ghatakas. Okay, and if the same question samprapti, so for example they have asked, so they will ask it as what, describe samprapti of what panduroga. So directly don't start with the word samprapti part. Okay, so because whenever you will be presenting the samprapti part, no, so there in the first you can see there you will use the term as what, nidana sevana. So what nidana they will be taking, you will not be knowing, no, so you will not be, they will, so they, you should write that one. Okay, so what nidanas already we have studied, but don't write more nidanas there, at least mention few nidanas, then you start with the what, samprapti. Okay, so here, and before beginning of the what, this is I have told in the what, so in the beginning only, so before presenting any disease you have to write related to to which srotas the disease is related, so which sroto dushti prakara it is there. Okay, so whether you are writing the types, whether you are writing the hetu or the samprapti, so this one or any this one lakshanas, so first you need to mention the sroto vikara of that disease. Okay, so here you can see, so this shloka, so it can be splitted into the what, flow chart. You have to present like this. Okay, and so if you present like this, automatically the samprapti ghatakas also, so you will come to know easily. So for example nidana sevana, so from that what it is going have, so mainly it is related to the what, pittakara ahara vihara nidanas, pitta vruddhi. So this one there will be the what, pitta pradhana tridosha prakopaka. So there will be the what, dushta pitta, so dushta vata, so they will moves the dushta pitta through the hrudaya dashadhamani to the sarva sharira. So there will be the what, dushan of the kapha rasta rakta mamsa. There will be the what, dhatu shitilata, due to the what, dushan of the what, kapha rasa rakta mamsa. So there will be the what, bala varna ojas shaya. So you are going to observe vividha varna tvacha. So this one you can see, so this at least try to memorize this shloka. Okay, so you will be, so you can present the samprapti flow chart very easily. So this one dosha pitta pradhanastu, the same you can observe. So due to the nidana sevana, so you look it in the samprapti, try to mention it in the flow chart. There will be the what, pitta pradhana, there will be the what, pitta dosha bruddhi, there will be the what, pitta prakopa. So there will be the what, dhatushu kupyanti. So you can observe in the what, samprapti flow chart. And after that one you have to, I have already told, so this one you have to write the samprapti ghatakas also after the completion of the what, samprapti flow chart. Okay, so if any samprapti part, so if they will, so remember, so listen carefully. So if they will ask, so if they ask in the what, 10 marks question, so this one anyway from the nidana only will be starting. So if they ask about nidana samprapti like that, but if they ask specifically for 5 marks, describe samprapti of that any specific roga, at that time you have to write first what, to which srotas it belongs, after that nidana part. So in the nidana part, so at least few nidanas you have to mention. You have, don't do what, so if I have read the nidanas fully, I have to concentrate, I will be writing more nidanas, and so you will not be getting more marks. So if you are not writing the samprapti ghatakas and samprapti chart, you will not be getting the marks. And so for the 5 marks, so there will be the what, only 3 pages, in that one only you have to complete. Okay, so try to what, so divide the disease, so the term according to the what, pages also, that is also more important in the what, Roga Nidana part. So whatever they have asked the question, no, so answer specific to that question. Okay, So let's move to the what? Purva Rupa. Okay. So this one, so you can, so this one, in the syllabus copy, and I want to tell you, wherever the described part they have mentioned, no, so read it carefully. So those, so whatever the description part is there, no, so they will be for what? 5 marks. They can ask for what? 5 marks. Single, they will be, so here in the Panduroga, so describe Purva Rupa for Pandu. They have mentioned it like that, okay, in the syllabus copy. So here in the Purva Rupa part, so how you need to answer means, so at least, so this one, well, if you have memorized the 2 shloka, then also it's okay. So if you have memorized, so this one, so at least try to memorize 1 shloka from the what? Purva Rupa. Okay, so 1 shloka from the Purva Rupa. The remaining part, how you have to do means, so this one, Acharya added the following lakshanas. Okay, so how you have to present means, so you suppose, I will give the example, you have memorized the Acharya Charaka's shloka. Okay, so that is Hridaya Spandanam, Rauksham, Svedhabhava, Shramastata. But you have not memorized the shloka from the what? Ashtanga, Hridaya, Nidana, Sthana. Okay, so at that time, what you have to do means, so you have to write it as what? So Acharya Vagbhata added the following lakshanas. That should be in the what? Points. Okay, so point 1. So that is so this one Aruchi. Point 2, Pitamutratvan, Alpavanita. Apart from the what? This one Charka Samhita. Okay, so apart from the added, just okay. So that's why I'm telling you people. So this one at least try to memorize 1 shloka. Okay, so or 2 shloka, it is more better. Okay, so next what? So this is what Acharya's Sushruta has mentioned. The added the following lakshanas. That is Tvakspotanam, Stevanam, Gatrasado, Mrudbhakshanam, Prekshana Kuta Shota, Vinmutra, Avipaka. Okay, so and the pattern of writing, how it should be means, so this one, so you have to write it in point wise, first point, second point, third point, fourth point, fifth point, and in front of that one you have to write the what? Explanation. Explanation means, so not fully lengthy sentence like that. What does the word mean? At least write like that. Okay, so this one in the Purva Rupa also the same pattern. Okay, so here, so this one, if they have asked the Purva Rupa of what, so this any specific disease, write the what and keep it in your mind. So this one Sroto Vikara. So this one you have to write. If they ask what Purva Rupa of Kushta also, so you have to write it as what it is, the Raktava Sroto Vikara. Next what you have to start with the what. So this one Purva Rupa. Okay, so here also if they have asked to describe Purva Rupa, so there you need to write 1 or the 2 shlokas. After that, so specific Acharya has added the what? Following lakshanas. First point, so what are the additional lakshanas the Acharya has added that you need to write when they will ask for what? 5 months. Okay. So next coming to the what? Types. So that is what? Bheda of the what? Panduroga. So there you have to mention it because according to different acharyas, so they will be of what? Different types. Okay. So if you see under the Panduroga, so this one they are according to Acharya Charaka. So they are of what? 5 types. According to Acharya Sushruta, they are of what? 4 types. Okay. So, but here you can see, so in the Sanipataja Pandu, so the Sushruta has included Mrutbhakshanajanya Pandu Roga under Sanipataja Pandu only. Okay. So this one, so according to Charaka, 5 types. According to Sushruta, so this one 4 types. Okay. So you have to mention. And these types, so you need, so whenever they will be asking, for example, Shota, Jwara, it is there, chapter in the Jwara. So you have to write, and Vatrakta. So you have to write on what basis the disease has divided. Okay, so the types they are mentioned. For example, so this one in Jwara, we are, so this one Saumya Jwara, it is there, Agneya Jwara, it is there, Antarvega Jwara is there, Bahirvega Jwara is there. And when it comes to Rakta Pitta, so we are, so there also Urdhvagata Rakta Pitta, so Adogata, Tiryagata. So on what basis it has divided? On the basis of what? Gati. So this one, next Vatarakta. So this one, Uttana, Gambhira, Vatarakta. On what basis they have divided? Based on the what? Avastha of the what? Vatarakta. So here there is no any basis. So this one they have mentioned. So this one. So Acharya Charaka has mentioned these types. So this Acharya Sushruta has mentioned 4 types. Okay. So and so this this whatever types you will be learning, no. So it will be helpful in case of what MCQs questions. Okay. So they will ask the questions like this according to Acharya Charaka. So this one or Charaka Samhita. So this Pandu Roga has included. Like that they will ask. Okay. The next question, the slide, Samanya Lakshanas. Okay, so here, if you look in the syllabus copy, so there they have mentioned. So this one, that is what describe the Pratyatma Lakshanas of what Panduroga. Okay, so there, so this one, if it's better to what memorize the shlokas. So when you will be memorize, I want to tell you people. So when you will be memorizing the shloka, no, at least you will come to know the terms, and you will be writing it in the what point wise. Okay, so so here, so what will be there? So this one, so alparakto alpamedasko. So next nisara shitilendriya vaivarnam bhajate. Okay, so this is according to, so the same shloka, so that is it is the ending in the what samprapti, this one. So next you the same thing, so here you have to write it in what point wise. So this one, so it is what Samanya Lakshanas of what Panduroga. Okay, so here whenever they will be asking the Lakshanas, no, so they read the question carefully. Sometimes they will be asking the Vishesha Lakshanas of what the some diseases. For example, so they will be the Vishesha Lakshanas of what Mahakushta and Kshudra Kushta. So there you have to mention the what Vishesha Lakshanas, not the Samanya Lakshanas. Okay, so that's why I'm telling you. So whenever you will be reading the question, no, so this one read carefully what they have asked. If you miss the Samanya or the what Vishesha part, you have lost the what marks there. Okay, next slide. So here, so in the what Vishesha Lakshanas, so this one in the point wise you need to write down. Okay, so like this you make. Okay, so this one 1 2, so the first point, second point, third point, fourth point, like that. Okay, so if you are not, if you are not the memorizer, so this, so what will be there? There will be in the Vataja Pandu, Krishna Pandutva will be there, Ruksha Arunangatva will be there, and when comes to the pain, so we will be observing different types of the pain. So there will be the Ruja will be there, Toda will be there, Kampa will be there, and Varcha Shosha will be there. Okay, so next when it comes to what Pittaja Pandu, so here, so you will be observing, so Pita Harita Abhavarna, Jwara Daha, Trishna, Murcha, Pipasa, like that. Okay, so when it comes to Kafaja, so you will be observing Shweta Varchas, Nakha, like that. So what I want to tell you is, so when you will be writing the Vishesha Lakshanas, no, so what are the differences you will be observing in the what? So doshaja, so you need to differentiate it. Okay, so then only you will be you can differentiate in between the what Vishesha Lakshanas. Otherwise it will be very confusing. Okay, so here you can see, so Varna, so this one I have divided. So the Vataja Pandu Lakshana, Pittaja Pandu Lakshana, Kafaja Pandu Lakshana, and Sanipataja. So it will be what? Combination of what? All the Doshaja Lakshanas. Okay, so this one we can divide. So this Vataja Pandu Lakshana, so all the Doshaja Pandu Lakshana based on Varna, Asya, so Kama, desire, Varchas, and other things. Okay, so at least try to differentiate between the what Doshaja Pandu Lakshanas. Okay, and in your syllabus copy it is also there. Okay, so this one, if you will differentiate like this, so it will be what useful when you will be writing the Vishesha Lakshanas. Not only Panduroga I am telling, you can make the tables for each and every disease. Okay, so when it comes to what Varna, so in the Vataja Pandu, so there will be the Krishna Panduta, Aruna Vivarnata of the what? Nakha, Mukha, Mutra. When it comes to Pittaja Pandu, there will be the what? Pita Harita Abha Varnata of the what? Nakha, Mukha, Mutra, and what? Purisha. Okay, so here next, when it comes to Kafaja Pandu, so there will be the what? Shukla Varnata of the what? Nakha, Mukha, Mutra, Purusha. Okay. And when you come, so when it comes to the what Asya part, so then in the Vataja Pandu, we will be observing Asya Vairasya. In the Pittaja Pandu, we will be observing Katukasya, and Kafaja Pandu will be observing the what Madhurasyata. So when it comes to what the Kamashcha, Shita Kamashcha, in case of what Pittaja Pandu, Katurukshoshna Kamata, desire to have these things. Okay. And when it comes to the Varchas, so there will be the what? Varcha Shoshas. In case of Pittaja Pandu, so we will be observing Bhinna Varchas. And you can write, so this one Pita Purusha also here. Okay, you can write the, because you are writing the Varchas part, no? So this one Pita Purusha also you can write. And in case of the Kafaja Pandu, Shukla Varna Purusha. Okay. And so this one you have divided the Lakshanas according to the basis of what Varna, Asya, Kama, Varchas. Okay. So next you need to write what other Lakshanas. Other Lakshanas will be common. For example, if Vata it is there, Angamarda Rujata, the Kampa will be there. If Pittaja Pandu will be there, sorry, if any Pittaja involvement will be there will be Jwara, Daha, Trushna, Mocha, Pipasa. Okay. So if Kapha will be there, involvement will be there, Praseka, Loma, Harsha, Anga, Sada will be there. But what makes it specific? Underline those terms. And it is better to make the table like this. Okay. So, and daily you make the revision. Okay. So simply by hearting, it's of no use. Okay. So I will. So in the next slide, so that is what Mrudbhakshana Janya Pando. So this one, and in sometimes what will be happening, no? There are some diseases which will be asked specifically. For example, when it comes to Jwara part, so there you will be having the Sanipata Jwara, Vishama Jwara like that. So there also how you need to write. So I will tell you. Okay. So here, so Mrudbhakshana Janya Pandu. So here, so whenever you will be writing that part, so here also if they have asked for 5 marks, so this one you will be knowing. So it is a which Srotas related. So next, a simple definition about the word Pandu. Now don't elaborate fully. Next what? Mrut Janya Pandu. So this one Mrut Janya Pandu means what? What is the main Nidana there? Okay. So next what? So in the from the shloka I am telling. Okay. So next what is the Samprapti? So this after writing this shloka, so you have to present the Samprapti part in the what flow chart. Okay. So next what Lakshanas. Okay. So there you have to, so this one continuously if you are writing this shloka, that's of no use. Okay. So no use means you'll be writing, so it's not of no use. So divide it into the what parts. Okay. First when you will be writing the Nidana part, no, so this one Mrutika Dana Shilasya Kupyatanato Mala. Okay. So mainly it is caused due to the what intake of the what mud. Okay. So next what, so different types of the what mud. Okay. So next what Samprapti flow chart. First I will show you, then you will come to have about that idea about that one. So this first 3 parts are there, no? So there it comes the what Nidana part. So that is what from the Kashaya Rasa Mrut Sevana. So that there next Kshara Rasa Mrut Sevana, Madhura Rasa Mrut Sevana. Okay. So there, so you can see Kashaya Marutam, Pitta Mushara, Madhura Kafam. So there will be the what different types of the what intake of the what mud. So automatically, so next comes the what Samprapti flow chart. There you have to continue the what Samprapti flow chart. After writing the Samprapti flow chart, no, so write this shloka part. Okay. So here, so write, so this part of the what shloka. So after completing the what Samprapti flow chart, so divide it. So divide the shloka. So that presentation it will look what, so into what points. Okay. And you will not forget the shloka also if you are dividing it, if you are reading the in this pattern. Okay. Next slide. Okay, so next coming to the Sadhya Sadhyata part. So here, when coming to the most of all the students, so they will be neglecting this part. So here I have told you in the beginning only, so they wherever the describe part is mentioned, no, don't neglect that one. So because they will be asking for what? 5 marks. Okay. So here, so they have asked, so they describe the Sadhya Sadhyata of the many diseases they have mentioned. So one of them it is about Pandu also. In the Rakta Pitta also they have asked. Kushta also they have asked. So be specific. Okay, so there you need to concentrate more. So because those all questions, it will be coming for what? 5 marks. Okay, so wherever that describe Purva Rupa, describe Lakshanas, individually they have mentioned no. So there you need to prepare one shloka for that one, and remaining other Acharya slokas, sorry, Lakshanas. So you need to add there. Okay, so here you can see here, either you can add this this one Acharya Charaka shloka or Sushruta shloka. Okay, so these Sadhya Sadhyata also write it in what? Point wise. Okay, so if you are presenting like this, it will be looking what? So this it in always try to mention it in what? Point wise. And whenever you will be writing the Sadhya Sadhyatano, so this one Upadravas also try to mention, because in if it is associated with all the Upadravas, so then it is considered as what? Asadhya. Like that they have will be mentioning it in the what? Some diseases. Okay, so here also when they will ask the Upadrava of the specific question, no, there also you need to answer it. Okay, so there for example Upadravas of the Vatarakta they have asked, Rakta Pitta also asked, Kushta also asked, and even this Prameha also asked. So there you need to concentrate more. Okay, so this I have so when it comes to the Shwasa part, no, so just I'm showing the one example. So this one, okay. So here also, so we will be having the word Pancha Shwasa here. So this is the Shwasa part. Okay, so once I will do the revision, this one Pandaroga, if they will ask, okay. So if they have asked for 10 marks, be specific to the what? That question. Okay, so first what you have to write? So in the beginning, so which Sroto Vikara it is related. Okay, so next what you have to write? Nidana part. Okay, so Nidana part, shloka plus divide it into what? That shloka divide it into what? Nidanas. Whether it is under Aharaja Nidanas, what points to be included, under Viharaja Nidanas, what points to be included. Okay, and Manasika Nidanas, what points should be included. Okay, and others. So this one, if they are not included in the what Aharaja or the Viharaja, there you can mention it as what? Others. Okay, so next comes the what? Samprapti. Okay, so there Samprapti, it is better to write Samprapti immediately after the what? Nidana, because you will be starting the flow chart from the what? Nidana Sevana only. So by the, okay, so there it is better to present like that. Okay, so this one Nidana Sevana, and remember Samprapti in the what? Flow chart, Samprapti in the and after that one Samprapti Ghatakas. Okay, and if the same Purva in the 10 marks they have asked for what? Purva Rupa. So there, so one or the shloka and Acharya has added. Depending upon the marks distribution, you have to present. But if they are asking for 5 marks, it is compulsory to add other lakshanas, so other acharyas lakshanas also here. Okay, so but if they are asking for 10 marks, so for example in the 10 marks it is distributed into what? Nidana, Samprapti, Purva Rupa, Bhedanusara lakshanas. So then you have to divide it into what? 2 marks like that. Okay, either 3 marks like that. Okay, so for 2 marks how much we have to write, like that you have to divide. For 5 marks, so how much we have to write? So you have to differentiate like that. Okay, after the Samprapti, so you have to go for the what? So this one next lakshanas. Okay, so that is types. Sorry, types. Purva Rupa. After that one Bhedas. Okay, in the Purva Rupa part also I have told. So next what? Bhedas. Next Samanya Lakshanas. So Samanya Lakshanas also should be mentioned in the what? Point wise only. So but when they will be asking specifically, try to write like that. So when you will be writing the Vishesha Lakshanas, so write it in point wise, and in front of that one you need to write the what? Simple meaning of that one. Okay. So next comes what? Differentiation. So this one. So if they have asked the what? Differentiate the what? Doshaja lakshanas. At that time you need to write like this. Okay. So if you remember like this, so you can easily write the what? Vishesha lakshanas of the what? Specific disease. Okay. So next what? Mrutbhakshana Janya Pandu. And one more I want to tell you. So if any disease, if they ask specifically, so this one, so there you have to concentrate more upon that one. So in some in some points of the syllabus, they have mentioned, for example, Tamaku Shwasa is there. In some diseases, Baddha Budodara it is there, Jalodara it is there. There you need to mention the what? Nidanas related to that diseases only. Okay. Sannipata Jajora, if you are writing, so it is a combination of all the three doshas. So combination of all the lakshanas, that is totally wrong. Okay. So there they have mentioned the specific lakshanas, so to which related. And so this one, they may ask for about 5 marks question also. Sometimes in the 10 marks question also it is included. So how they will, so describe Sannipata Jajora, how you have to write. So it is a Rasavaha Sroto Vikara. So next comes what? So this, so how many types Acharya Charaka has mentioned what? So it is mainly caused due to the combination of the three doshas. Next what? So next point. So the Acharya Charaka has mentioned 13 types of the word Sannipata Jajora. Next Lakshanas. Next what? Upadrava. Like that you need to what? Divide. Okay, so whenever they will be asking the what? Specific question. Okay. So here when it comes to what? Shwasa. So here I want to tell you, so this one how, so Shwasa chapter also it will be looking what's big to you people. But here the Nidanas, so you can, there are no any specific Nidanas for these types of the Shwasa. Okay. So only if you're next. So what are the differences? You can see these types of the what? Shwasa. Because so this one individual Shwasa, they may ask for what? 5 marks questions also. So when it comes to the what? Shwasa, so there you can divide what type of the what? Shwasa you will be observing in these 5 types of the what? Shwasa. What type of the Shabda you will be observing in these type of the Shwasa. Chetas, what you will be observing. How? So next Netra, Shula, Vak, Asya. Next Sadhya Sadhyata. Here I have left one more point. You can add what? Dosha Pradhanyata also in this 5 types of the word Shwasa. Okay. So and when you will be writing the Vishishta Lakshanas, no, these will be helpful to you people at that time. Okay. So for example, in the Mahashwasa, so this what type of the Shwasas you will be observing. In the Mahashwasa, you will be observing Uchchai Shwasati. In the Urdhva Shwasa, Dirgham Shwasati. Next, Chinna Shwasa, there will be the what? Vichinna Shwasa. Next, so Tamaka Shwasa, there will be the what? Ativa Tivra Vegam. In the Shudra Shwasa, so that is Ruksha, it will not be having any Upadrava. It is mainly caused due to the what? Ruksha, Dahara, Ayasa, like that. Okay. So, and what type of the Shabda you will be observing here? So, there will be the what? Mattarshaba, Ivanisham. Okay. So, next what? So, this one Shabda related to Tamaka Shwasa, there will be the what? Gurguraka. So, when it comes to the Chetas, in the Mahashwasa, you will be observing Pranashta Jnana Vigyana. In the Urdhva Shwasa, you will be observing Pramoha and Tama. In the Chinna Shwasa, Vichetaha. In the Tamaka Shwasa, Pramoha and Tama. Okay, so like this you make the what differences. When it comes to the what Netra, so in the Mahashwasa, Vibranta Lochana and Vikrutakshana. And if you remember like this, so this one, what are the differences? Easily, so when you will be asked for the specific question, no, easily you can write the what Vishishta Lakshanas of the what particular disease. Okay. So this one Urdhva Shwasa, Urdhva Drishti. Okay. So next what? When it comes to Asya, Shushkasya, Parishushkasya. When it comes to Sadhya, Sadhyata, so this Mahashwasa is Asadhya, Urdhva Shwasa is Asadhya. And sometimes in the MCQ questions also, they will be asking the questions. For example, so when it comes to the what Chinna Shwasa, so you will be observing Raktaika Lochana. So you will be observing redness of the one eye. Okay. And so this one Rakta Lochanata, you will be observing in the what? Shita Pitta disease also. But the difference here it is what? So you will be observing the redness in the what? Only one eye. So this one Raktaika Lochana, it is one mentioned in, it is a specific feature of following diseases. They will give the option like this. So that's why whenever you will be reading the Vishishta Lakshanas, no, be specific through that one. Especially, so in types of the word Kushta, I am telling you people. So read the specific. Okay, so for Shudra Kushta, Maha Kushta Lakshanas, how it will be. Okay, so not only Kushta, so this one Vishishta Lakshana of what? All the disease you need to what you should be what specific that one. And when it comes to the modern part, so here they have mentioned it in under what desire to know part and the what nice to know part. Okay, means so these same questions, so these modern part questions, so they may or may not may not, so means they will be one question for the 5 marks. It will be from the what desire to know part. Okay, so so when it comes to the modern part, so how you need to write, so you have to follow these patterns whenever they will. For example, if they ask what any features, clinical features or the investigations, so directly if you are starting with about clinical features, so that is of no use. Okay, so this one, because you have to write so about the disease. Okay, so what are the causes for that one, at least few. Okay, so first the definition part you have to write down and few causes. Okay, so this one answer should be what specific. You have to concentrate more upon the what question asked. If they have asked the question related to what clinical features, so you have to concentrate more upon what clinical features. Others should be in the what small points. Okay, so if they are concentrating more upon the relevant investigation, there you need to concentrate more upon the what investigation part. Okay, so there, so like that you have to write the what answers. Okay, so for example, whenever you will be writing the modern part, first definition, next causes, next clinical features, so next diagnosis. So under the diagnosis part only, so there will be the clinical examination or the clinical evaluation and relevant investigations. Relevant investigation, so they may be of what laboratory investigations or the imaging studies or the endoscopic, okay, anything. Okay, so divide the what industry investigation, but they should be what relevant investigations. Okay, so it is not like that. So this one everything, if they have asked the disease directly, some students they will be writing. They, if we ask any disease also, so they will be starting from the what CBC part. So don't do like that. Okay, so if they have asked the any disease, specific relevant investigation should be there. I will give one example for that, for one disease. For example, so I have taken the what example of what cirrhosis of the liver. Okay, so here, so and it is not like that you have to write the same definition only. Okay, so you can collect the definitions from the what different sources. Okay, so it is not like that you have to write like this only, like this, but it should be what specific to the what question asked. Okay, so here, so coming to the definition, so it is about consequence of the what chronic liver disease characterized by the replacement of the liver tissues by fibrosis, scar tissue and regeneration nodules, leading to the loss of liver function and disruption of what liver architecture. Okay, so in the whole definition we came to know that so the liver, it has affected, so what the pathogenesis it is happened. Okay, so like, so this definition should be should be framed like that. Okay, for every modern disease. And for the causes, so this one at least 4 to 5 causes. Okay, so whenever they will be asking. Okay, so here, so when, because they will be asking the clinical examination and investigations part, and sometimes what how they will be asking means, so describe the whole disease, like that they will be asking. So if you are concentrating only upon the causes, that's of no uses. If you are concentrating only upon the what introductory part or the definition part, so no, you will not be getting the marks. Okay, so next, what clinical features also. So this one, so you can select so any this one. Okay, so any specific symptoms, so it is not like that you have to write the same clinical features so of this one. Okay, so but it should be relevant to that disease. Okay, so here, so you have to mention the clinical features. And I would like to suggest you people, so whenever you will be reading the what modern diseases, no, so this contemporary science diseases, at least so the signs and symptoms, so read it by taking the pictures like this. Okay, so it will be there in your mind. Okay, so this one, so present, so according to the what systemic wise also, that also will be helpful. Okay, so but it should be main, so the for every disease if you are mentioning loss of appetite like that, that's of no use. You should be what relevant answer should be there. Okay, relevant clinical symptoms should be there. Okay, next, investigation part, diagnosis part and the investigation part, how you need to write, I will tell you. Okay, so here, so this one diagnosis, it is based on, it is, as it is about liver cirrhosis, it is based on blood test, imaging studies and liver biopsy, but it will not be so it will, so some diseases it will be based on the upon what clinical examinations also. For example, so vata vyadhis are there. Okay, so if you are writing the vata vyadhis under the diagnosis part, whenever that modern part, so it is of so the answer will become wrong. So this one osteoarthritis it is there, rheumatoid arthritis is there, so there you and there you need to write what Bell's palsy it is there. So there the diagnosis is based on what clinical examination. You need to write like that. Okay. So here when it will be specific to the what laboratory investigations mainly. So you have to specify. Okay. Whenever it will be clinical examination. So you have to write under the clinical examination part more. Okay. So in the blood investigations. So as it is the part it is affected here, it is what liver. So that's why you have to start with the what LFT. Okay, so blood investigations. So if you are writing the urine or the blood, so this one or any CBC or the ESR, so that's it will be what that answer that the investigation will be what irrelevant. Okay, so that's why you have to, because already it is mentioned in the what syllabus. So relevant investigations and interpretations also they have mentioned. Okay, so this one sometimes they will be asking, so describe the clinical features and write the investigation. Sometimes they will be asking what, write the interpretations of the what following disease. Okay, so they will not be at that time. You should be specific what you are going to interpret that the disease. Okay, for example, so here you can see, so this one in the LFT it shows what SGOT, SGPT, serum bilirubin, globulin and PT, prolonged prothrombin time, it will be prolonged. Okay, so in the LFT. So when you will be writing, so this one, when they will be concentrating only upon what investigation, so write it in point wise, elevated SGOT, elevated SGP, like that also you can present. Okay, so when there will be the what, so in case of the what biliary obstruction, so along with the SGOT, SGPT, GGT, alkaline phosphatase will be what, so also elevated, at least mention like this for all the what diseases. Okay, and when it comes to the what imaging studies, so for example USG so in the USG, so what you will be observing, so you will mainly, so in the clinical features of the liver cirrhosis, what you will be observing, so the liver size will be what reduced. Okay, so this next what it will be, and spleen size how it will be, we will be observing the what splenomegaly, and we will be observing portal hypertension as well as what ascites. So to detect, to assess the what liver spleen size fluid in the abdomen, you will be doing what USG of the what abdomen. Okay, so as next what clinical features you will be observing what, so this one esophageal varices also, and as well as what abnormal stomach veins also. So there you will be writing, so this one endoscopic part. Okay, and when it comes to the what liver biopsy, so this to confirm the diagnosis of the what cirrhosis, so the liver biopsy is done. Okay, so this one you need to mention like this. So whenever you will be interpretation. Okay, so when it comes to the what so this one so I want to share you for, so when while writing the exams, so I want to share some of the points so which are related to this one. So here paper 2, so this before writing any answer, so read the question and understand. Okay, so when you will be writing the specific answer, no, so read the question and Understand? So whether it may be Ayurvedic part or the modern part. So specifically when you will be writing the 10 marks question, so Nidana, Purva Rupa, so what point they have asked you particularly in the 10 marks question, whether they have asked Nidana part or the Purva Rupa part or the Beda or the Lakshanas or Sadhya Sadhyata, you need to specify that, okay? And answer to the point. So this point asked in the what question, okay? So this if they have asked you Samprapti part, so this one if you are mentioning the Purva Rupa part, so this one that's of what no use, okay? And always answer it in the what allotted space. For example, for the 10 marks question already you will be knowing, okay? So this one only, so we have to adjust this answer, okay? So this you have to, and whenever you will be writing any disease, so write the what Srotos Vikara and Samprapti, so in the what flow chart, so and write the shloka wherever applicable. It's not like that for every disease we need to write the shlokas, okay? So wherever it is applicable, no, you need to write the shloka there. And the main thing, and I want to tell you one more thing. So whenever you will be writing any, while starting any disease, don't write the comparison, okay? So this disease can be compared with the what? This disease, okay? So here, and don't write the what? Treatment part or the patya. Many of you will be doing, okay? So after the completion of the, so this one disease, you will be writing its treatment, but it is not applicable in the what? Roga Nidana disease part. So here, paper-2 part. So you need to write, so this one up to the only, up to the diagnosis part only, okay? So here, no patya or the treatment part, okay? And the time management is necessary, okay? So here, so mainly, so this one allocation of the time, it is what very important whenever you will be presenting any disease part, okay? So here, so this one, so if you are having any doubts regarding the paper-2, you can ask. Hello? Hello? Hello?
Yes, ma'am. Yes, ma'am.
It's not like that. And I want to tell you in the disease part, in the paper-2 part, so this is the important question, this we have to share. So this is, it is not like that. They may ask any part of the question. So read it carefully. So this one, whenever you will be reading this one, write answer to the what point, okay? Hello?
Hello, ma'am.
Yes, ma'am. We will wait for 1 minute. If any questions are there, I will let you know, ma'am.
Okay. And lastly, I want to tell you, so this one, don't take stress. So wish you all of you, so good luck for your exams and do the best. If any questions are there, you can ask.
No questions, ma'am.
Okay.
Okay,
And I
thank you,
would
ma'am.
like to thank the Jignasa team also for giving me this wonderful opportunity to present the paper-2, Roga Nidana paper-2. Thank you.
Thank you, ma'am.
Thank
We
you
now come to the end of the
friends for
session.
the patience hearing.
On behalf of my whole Jignasa team, I extend my heartfelt gratitude to Dr. Sheethal, ma'am, for presenting the session despite of their busy time. It was very helpful for us, ma'am. Thanks to all Jignasa team for conducting the session. Thank you, ma'am.